We're live? Good morning, everybody. Thank you so much for being here today. We are delighted to be here with an exciting announcment about some really important work that our Department of Public Health is engaging with some of our community partners who are honored to join us here today. As you all may know, that this week will be Overdose Awareness Day, August 31st, the world's largest campaign to end overdose. And we thought it was incredibly important for us to make this announcement today in light of some of the very important work that we have been doing and are excited to announce we will be expanding. The high-level news we're excited to share is that the Denver Department of Public Health and Environment, through their incredible work, just received a federal grant worth $10 million to help expand our support of treatment for folks who are at risk of overdose. So that requires an amazing round of applause. And this will be over the next 5 years, so it's about $2 million a year, but it is a real recognition of the work that this team has done, both around harm reduction and around linkage to care. So these are dollars we will use to expand the incredible work that the team is doing now to make sure we can meet people wherever they are in their moment of need, connect them to services, get them into treatment, and try to keep them in treatment long-term to get them healthy and back up on their feet. There will be many other innovative parts of this program that will include how we look at gathering and using data, how we look at safe testing opportunities. But I really wanted to highlight these two areas of focus around increasing our linkage to care and also making sure that we are increasing our efforts around harm reduction. We have great partners that are doing that work around the city. I'm also delighted to be joined by one of our great community partners, Blazing Cloud, who is here today, who is an amazing nonprofit that will be working on both our linkage to care as well as on harm reduction across the city. And so we think this is a moment many of us have folks that we know and have loved that we have lost overdose. And I think on this day and this week, it is important to realize how critical of a crisis that is. We know last year we lost almost 600 people in the city and county of Denver to overdose. We are ready, thanks to the incredible work of the DDPHE team. We are on path to reduce that number by about 15% this year. We know that is great progress and still not enough. We want to be able to use these resources to do more faster for all the folks that need us. And so we are really honored to announce this today. I'm excited to give it over to the head of DDPHE, Karen McGowan, who leads the incredible team who has both done this work and received this great honor to advance the work going forward. So Karen, I'll turn it over to you.
Thank you, Mayor. And I just want to, again, reiterate thank you to the staff who's working in this very difficult space and to our community partners who are what I call in the right place at the right time. And that's really the work that needs to get done. We're grateful to be here today with everyone, remembering those we have lost from overdose. While the battle against substance misuse continues, we see hope in the many community partnerships we have to help fight for people's health and well-being. We see hope in the programs supported by the city to provide resources to change the trajectory of overdose, such as the Wellness Winnie, our Sun Navigators, Roads to Recovery, and STAR. With this new CDC Overdose Data to Action grant, we add another tool to the toolbox to build on existing programs and try new ideas that lead to better health outcomes. The OD2A grant will not get to the heart of why we have substance misuse crisis in our community. The why is an individual story and journey, but we're hoping that the OD2A grant can help us with the what, where, when, and how. With this $9 million grant, we will be able to collect more robust data about overdose and overdose deaths. We will partner with harm reduction providers to monitor and test the illicit substance supply in our community, such as fentanyl, non-synthetic opioids, cocaine, and methamphetamine. We hope to identify changes in the market that might drive different strategies from the city and our community partners for prevention. For example, if the supply shifts away from fentanyl, naloxone as an overdose prevention tool will not be as useful as a strategy as it is now. In addition, about half of this grant will go out to our community-based partners, such as Blazing Cloud Consulting, Rue Black Consulting, and Promotores de Esperanza, to provide more resources to connect people to behavioral health, substance misuse, and housing programs, and to understand which tools they provide, such as naloxone or testing strips for fentanyl or xylazine, whether they will be successful in preventing overdose. Denver is lucky to have partners that know how to reach underserved populations and provide culturally and linguistically supportive services in the right places. It is my privilege to introduce one of our community leaders in this space, Rica Rodriguez with Promotores de Esperanza.
Hey. Good morning, and thank you. A little bit of the nerves, but I'm going to be okay. As Karen said, I'm Rika Rodriguez. I am the founder and executive director with Promotores de Esperanza, where our mission is to promote racial and ethnic health equity through the provision of culturally and linguistically competent services designed to minimize the barriers within our most vulnerable and marginalized populations. We are boots on the ground. We work alongside our fabulous partners, Blazing Cloud Consulting, Rue Blacks, and our groups are energized, and we're very honored to be able to provide education within the Native American community, the Spanish-speaking communities, and the Black communities. All about the intersections of harm reduction, how those intermingle, and about the dangers of illicit street drugs. We provide overdose awareness. We do prevention options that are available to the people who we serve. We provide linkage to various types of avenues of care, including mental health, and then we walk alongside these individuals as they find what their meaning of wellness is to them. We act through a harm reduction lens, and we act with non-biased opinions in all of our organizations. And I lost my spot, sorry. On a daily basis, we are distributing free naloxone, free fentanyl and xylazine testing strips, and we offer a ton of educational materials around those items. We place those items into the hands of the communities that are most left behind in our community, and we ensure that each person that we encounter, that they have the tools and the education that they need to save a life in the instance of an overdose. As an opioid survivor and as an overdose survivor, I am honored to receive the Overdose to Data Action Grant that is imperative to ensuring that our work continues in these communities. Sorry. Once again, for the crisis for our people is what we are really fighting for. Blazing Cloud, Rue Black, and Promotores, we are a trusted group of individuals within our communities who utilize our familiar faces and our lived and living experiences to advocate for the inclusive and equitable change within our communities and to elevate this work through OD2A grant. Sorry, lost my space again. As a result of this funding, Promotores de Esperanza has been able to work tirelessly in developing relationships in non-traditional and establishments such as Spanish-speaking nightclubs, liquor stores, dispensaries, community organizations, and small business owners to install naloxone display cases with free naloxone for their patrons to have in their hands. These display cases, they hold 22 doses of naloxone, which we are filling on a weekly basis. So that's a lot of Narcan and naloxone that is hitting our streets and touching our communities. Yes. So I want to thank DDPHE, all of the partners, everybody involved, Marianne, because she's always pulling, these people into the fold and making sure that our voices are heard. So thank you so very much. And lastly, I would like to invite you all back here to these very steps at 4:15 to learn about other crucial overdose prevention avenues that can help to combat this horrible crisis that we're seeing in our beautiful Colorado streets. Yes. Thank you, and I'll hand it back to the mayor.
Thank you. You're amazing. Well done.
Thank you.
Thank you all so much. So I think just in summary, we see this as an incredible opportunity to first make sure we do everything we can on harm reduction. It's getting Narcan and naloxone into all the communities where people need them the most. Second, we're making sure we're culturally responsive and getting to the communities that we know are most likely to be at risk. We see overrepresentation of our Native and Indigenous communities here, of our Black communities, of our Latino communities, and we are honored to have community partners who know exactly how to reach, communicate, and support those populations at the moment they need us the most. So we are incredibly grateful for their partnership on this. Yes. And then the third, we rely on their relationships and partnerships to then connect those folks with the opportunity to get linked to care. In the moment when you are open, you are willing with a trusted community partner, our ability to have an offer of high quality treatment available in the moment that you are ready is what makes the difference between life and death. And so we are incredibly grateful to our community partners. I want to give a huge round of applause to our team at DDPHE who's done transformational work in this space. And we think this is a great recognition of the work that this community has been doing and all the work that we know we still have left to do. And this $9 million will help us accelerate that as dramatically as we can. And which is all aligned in part to our efforts around Roads to Recovery, which is also an effort focused on those folks most at need, who we want to be able to get access to services and access to care in an ongoing way, to not just keep them out of the criminal justice system, but most of all, connect them to treatment. So we are delighted to have this incredible group of partners with us today. I am happy to pause there and take some questions or phone a friend from the experts who will probably have better answers than I will.
A few examples were given of the data to treatment concept, but could you kind of explain that again, how you can use data for treatment using this grant?
Okay, you want to do that, or do you want us to call in? You can phone any friends.
Where is Rose?
Rose is
Or Tristan, either one.
Can you repeat the question
Oh,
for you?
the question is, could you, obviously this grant is to be used data to treatment. What does that mean?
Yeah, hi, Tristan Sanders. I'm the Director for Community Behavioral Health at DPHE. You know, a big focus of this grant is actually getting all of the data sources that speak to overdose deaths and also overdose injuries in one place so that we can really understand what that data looks like and make data-informed decisions on the ground. There's data that exists in the ER, there's data that exists in the medical examiner, unfortunately. There's data that exists all across community partners that we really want to bring together and be able to understand so that we can make informed decisions about how we're actually tackling this issue.
Don't forget qualitative data as well.
She said it. Don't forget qualitative data as well. There's stories to be told from people to really learn how we can actually address this. So comparing, putting quantitative data with qualitative data is really going to help us be able to figure out how to do this best.
Other questions? Yes, sir.
Where did this grant come from?
Where does the grant come from? CDC, the Center for Disease Control, out of the federal government. Other questions?
Can you give some context as to, so about $2 million per year over the 5 years, what sort of impact could that have? Maybe both of you guys could answer that.
Want to jump in, please?
Stephanie Salazar Rodriguez, owner and lead trainer of Blazing Cloud Consulting. We see it as on an everyday basis. This last Saturday, we held an Indigenous healing event, and we had close to 200 people there and gave out close to 100 doses of Narcan. So this is just one example of what we are doing on an everyday basis to make sure that we are out there in the communities that we are working with to ensure that people are getting what they need, and the education, the Narcan, testing strips, and then also some referrals to care. So we see it happening daily. So for us, when the CDC has asked us for some success stories, we say every day that we're working out there in community is a success.
Any other questions? Great. Very powerfully said. I think our belief is if we can, in the moment that you're most at risk, get you access to the materials you need to reduce the risk of harm, if we can, in those moments, connect you to a trusted partner and community leader who is going to increase the likelihood of you accessing treatment, if we can, if you are worried that you have a batch that is contaminated and lethal, get you access to testing that will confirm if there is really additional dangerous contaminants that could have overdose implications for people citywide, those steps in the hands of these right partners, we think have a dramatic opportunity to reduce the number of overdoses in this city and this state. And we're very proud to be recognized for this work and now very humbled to get back to this work with the right set of partners to make it possible. Thank you all so much for being here.
Thank you.